Hi, this is Dr. Artie Kavanaugh coming to you for Room Now from EULAR 2022 in Copenhagen. I just observed a session that I thought was really good. It was one of the scientific sessions, and it was on sarcopenia. Sarcopenia is an evolving topic and an important one to us as rheumatologists. There were 3 lectures. One was by Dr. Cruz from Madrid, and he set it up nicely with talking about the definition. So it's not just muscle mass being low, but it's muscle function being low and muscle strength being low. And of course, this happens a lot in our patients with rheumatoid arthritis. We talk about frailty, which is sort of a very related concept. There was a wonderful talk by Dr. James White from Duke talking about the immunology of muscle regeneration, and very similar to what we had heard about some years ago with tendons, where we didn't pay much attention to tendon injury and repair, but of course the immune system and the inflammatory response are absolutely crucial to tendon healing as they are to muscle healing. And we have micro tears in our muscles very frequently, and if you look at the list of characters that are involved in both cleaning up the damaged muscle and helping it to repair, we're looking at the same molecules that we're very interested in, key parts of the inflammatory response and the immune system. So there's certainly the potential for a lot of overlap. And this explains the important correlations that we see with sarcopenia in our rheumatoid arthritis patients. So numbers that they talked about is that about 10 to 20% of your well-controlled rheumatoid arthritis patients will have sarcopenia, compared to about 30% of your rheumatoid arthritis patients who are active. So important clinical problem. And then the final talk was by Dr. Madero, also from Madrid, and she focused a lot on CPK. CPK being sort of the currency for energy transfer in the muscle. And of course, we think about it as an indicator of muscle breakdown, as we do in our patients with myositis. And she related this to the issue that we see with the JAK inhibitors, where the treatment with JAK inhibitors often results in an elevated CPK. Instead of this being a bad thing, it may actually be a good thing and may reflect muscle regeneration. And it was just a fascinating kind of top-level review of the interplay between a field that we hadn't paid much attention to: muscle function, muscle regeneration, muscle breakdown, clearly important to our patients and involved with the immunopathogenesis of our disease and potentially relevant to our treatment. So fascinating seminar, and I think an important topic for the future. This is Artie Kavanaugh, EULAR 22 in Copenhagen for Room Now.